Hello, good morning, everybody. Good morning, Rose.
Good morning. Good morning.
All right. Well, hi, everyone. My name is Deepika Modali. I am the SART project coordinator here at the Texas Association Against Sexual Assault. And joining me today this morning is Rose Luna, our CEO. And with the latest legislative session has ended, and now that bills are coming into law, we wanted to jump on here and discuss some new legislation that is going to affect sexual assault response teams and the upcoming biannual report deadline. So we're just going to jump right in and talk a little bit about that. And so, Rose, I'm going to kind of just jump in and put
Okay.
the first question to you. And let's just give a quick overview about sexual assault response teams and the bill that passed 4 years ago, SB 476.
Yes, thank you, Deepika. And thank y'all for joining us so early this morning. I think it's early. It's 9:30. That's kind of early for some
That's
folks.
early.
Uh, for others, it's late. Um, no, I just wanted to say, very proud. Thank you, Deepika, for the work you're doing to keep everyone abreast of all the legislative changes that are in effect today as of 9/1, 2025. And that was as a result of the hard work of TAASA's policy team, task force, sexual assault survivor task force, the governor's office. So a lot of great laws. And today we're going to talk about one of them. At TAASA, we're going to have other implementation rollouts on different provisions of all these different laws that we were so successful in getting passed. That's a great thing. Implementation is just equally as important. So this is, piece one, for the implementation when it comes to SART. But with SART, the sexual response team, so in the 87th legislative session,
Mhm.
then Senator Jane Nelson, she worked with TAASA to get this bill passed, and that was to mandate SART coverage in every Texas county. And those of you that are from here, and even those of you that are not from here, you've all heard we have 254 counties. That's a lot of counties.
Woo.
And at that point, before we got started, I think, Deepika, it was like either 19 or 20 SARTs that I think, and I want to say it was governor's office that was doing some work to kind of, and TASA was doing some work as well. But I want to say that we got that number from the governor's office, but only half of them were functioning before this law
Mhm.
passed. So this law did a lot of work. And Deepika, right now, do you have the number off the top of your head? So we went from like 19 half functioning to what
19
we
to
are
like
now.
120
Oh
counties,
my
maybe
gosh,
a
that's
little bit
great.
more. So we went from like yeah, we did a big jump, like a huge jump. It went from like 33% to 60%. So we are chugging along. We're getting there. And I think actually the 120 is more around like the counties that we got reports from. I think it's closer to like um the 140s for like
Oh,
the
nice.
counties that are actually getting a start together. And I will say too, um even in the last couple of months, I've had folks reach out to me and be like, hey, we're gonna get started now, and we're working on it. We just had our first meeting, so it's happening.
Awesome. And I think it was so great when that passed, because getting it together, it wasn't just like one of us were saying, this is a great idea. And one of us may have done that, but actually this idea came from the Survivor Advisory Board. So we call it SAB, TASA SAB. It also came from the voices of the Survivor Centered Work Group, from the Sexual Assault Survivor Task Force. And then it just also happened to come from the ground up with the policy team doing their focus groups and talking to those on the ground. It was all a unified voices that weren't even talking to each other at that point, because we were just talking to people separately, that all said collectively, we need to mandate sexual assault response teams as they have the mandates for children and the MDTs, I think they're called. And so we needed to have that for adults. And so this law was passed again then in the 87th legislative session. And I think the one person who really put it together the best is why this exists. He's a county commissioner, and I always get his name wrong, but he's from Coryell County. I'm not even sure if he's still county judge over there. Roger Williams or Roger Miller. I don't know. That's one of those is the name. But as a county judge over in Coryell County, when we went to talk about this law to them, he said, "Oh, so what you're saying is that the sexual assault response team, that the reason why we exist, or what we should be aiming for, is for when a survivor does disclose to any of us they will not
Mhm.
regret it. And I'm like, my God, that's the best way. So I share that every time. I'm sure you all heard
Mhm.
this.
I love
Me
that
say that several times
story.
because I just think it was like his aha moment. We're in the parking lot actually leaving, and he said that, and I thought that was great. So yeah, so that was, we're taking it back, kind of back in the 87th SART. We mandated SART coverage in all Texas counties, and we've come a long way.
Mhm. Yeah, it's happening. I think we also have to think about, like, we do have 254 counties and every county is different. I feel I am not originally from Texas. I'm originally from Illinois in the Midwest, and Texas is just one of the most diverse, if not one of the most diverse states I've ever been in or lived in. Every county has its own needs, whether it's rural populations, urbans, mix, whatever. There's just so much. So we have to think about approaching each of these counties differently when it comes to sexual assault and to when it comes to utilizing the sexual assault response team. So it's a big project, but we are doing it. And I think the interest is there. And I think, the goal behind all of this, right, is to better serve sexual assault survivors.
Amen.
Yeah. Okay, and so let's talk a little bit about this new law that was passed. So can you speak a little bit more on what HB 47 is and how that relates back to SART?
So HB 47, that was an omnibus bill, and this was one of the priorities or policy recommendations from the Sexual Assault Survivor Task Force at the governor's office. And I think what's so great about that is it's this because it's an omnibus, it updates various pieces of Texas statutes to address sexual assault aspects and survivor components in different areas of the law. And when you think about omnibus, like the very definition of an omnibus bill is that it bundles together several distinct policy measures into like a single large legislative package. Sometimes they're unrelated, but in this case, the string that the theme, sorry, that strings them together is that it is about being more survivor centered. So this was an omnibus bill that addressed a lot of different things. One, lease termination. It addresses about ride share, like they have to have for you to be a driver in a rideshare option, they have to do a background check. There's some training components for emergency room physicians and PAs. There's all these different things, but one of those provisions had to do with sexual assault response teams and mandating that report is to not only do the SART, so that what's already in law is that SARTs have to submit this report to their county commissioners. The new piece, HB 47, addresses it adds a level of responsibility now to the county commissioners to submit that to the Sexual Assault Survivor Task Force. It is mandated. And I know we're going to talk later, Deepika's going to talk to us later about all the different details in between, but that is basically how HB 47 does relate to SARTs. And it's a big, I think it's a big change for SARTs. Like y'all have done such a great job already at getting up and go. I can't believe it's been 4 years already. It feels like yesterday, but it's been 4 years and we've grown exponentially. I think this is one of the untold stories, success stories in the state of Texas is SART and how it's come along. And so this here is, again, it's a huge thing, and so it was so important. Like, Deepika has created documents. We worked with the governor's office to do this, and we've got a lot more support, and we're going to talk about that here because it is such a big deal. But it's mandated. It's a mandated thing, so we're going to talk about that. We don't want anyone to feel blindsided by how come I didn't know about this. So our intention is to let everyone know, and the SART, working with the SARTs, and Deepika has great relations with all the SARTs in Texas. But that's basically it. Deepika's like this omnibus bill with all these provisions. The theme of was sexual assault survivor, centeredness, and this was one of those things that we wanted to make sure that we get the information in. Eventually, sorry, I keep going, but there's so much to say. Eventually, eventually, we'd like to compare apples to apples when it comes to data in Texas and crime victims and sexual assault survivors and all those different things. And right now, the SART report is a beautiful, like, compilation of data that tells a story what's happening locally, and we love that. And Deepika, you did a great job of putting that report together. And folks, if you want to see that report, statewide report that Deepika did, it's on our website on the SART page or on the resource page. But we're trying to move toward data where we can compare trends statewide. We're not there yet. We just need to get the data in, and we'll slowly all work together so that we're all a part of the change and all a part of the improvement that's necessary.
Yeah. And I think, one of the things we want to try to do, at least with this round of reporting, we got so much good information. But as you can see from the finding document, we got so much different information, right? From everybody. We had our required data points, which were great. And then we had asked for some additional data points. We had just said, everybody provide your data. So it was great to see, like, what the rape crisis centers were seeing, what the SANEs were seeing, what behavioral health was seeing. So we were getting all these like different great information, more nitty gritty from like law enforcement and sheriff's office, more of the detailed numbers and the prosecution. But I think what we want to do going forward is kind of zero in on the other data that we can collect in addition to our required data, right? Because we have these great required data points that are going to give us a lot of good information. And those are the number of sexual assault reports that are received by local law enforcement, the investigations that are conducted in result of those reports, the number of indictments presented in connection with the report, the number of reports for sexual assault where there was no indictment. And now there is a new reporting piece data point that is required, which is the number of rape kits that are past the statutory timeline for the transfer to the crime lab. So not being picked up from the healthcare facility by law enforcement. So that will just give us more of an idea of how to support when it comes to that. And I think that's been a data point people have been really interested in. And then moving forward, we want to make sure we're also catching data points from the healthcare perspective, from the advocacy perspective. So that's something I think we're going to be working on in the future. In the first place, I think it'll be in an unofficial capacity, and then eventually, hopefully, it'll be in an official capacity so we can continue to start to analyze that data so then that we can better support survivors across the state of Texas.
And Deepika, I was going to say, if it's okay, you had mentioned about the new data point that has, so not only do we have HB 47 that addresses and mandates that the sexual assault response team report is submitted to the task force by the county commissioners. So again, just so y'all know, what's still the same is that the SART needs to submit it to the county commissioner by December 1, and then from there. But the other piece that you mentioned, I believe I'm trying to find the right number because I always get these mixed up. I don't know why the numbers.
It's SB 608. I know. I always switch it in my brain. It's SB 608, I believe.
Okay, got it. SB 608. Okay, so that's TAASA's bill. I should know this, but it's TAASA's bill anyway. Yeah, 608. So it's TAASA's bill, and this was something that we successfully passed from a TAASA priority. We also, Ashley Brooks and Kristen Lanau, who worked with our team in the policy front, we also helped and worked with other folks to pass HB 47, which was not a TAASA priority, but it was a task force priority. But we were able to get that through. That's just kind of our function and the way that TAASA is set up. So we're very proud of the fact that we were able to get that through and folks that we work with. But the TAASA priority was SB 608. And that was as a result of just conversations that we had with DPS, conversations that we had with the same nurses about these kids that were just kind of sitting there. And so in addition to SART having to report those numbers of those kids that are still there past the statutory timeline, which is either 7 days for law enforcement to pick up and submit, or it's 14 days if they live 100 miles away, because we know Texas is huge and expansive, lots of rural. But the other thing is that DPS will then have to submit that information into a report, a biennial report to the legislature. So again, it's all about transparency. This is about, let's just work together. This is not about shaming anybody or finger wagging. Let's just figure out where the gaps are. And this is kind of a way to address both those things.
Yeah. And I think, it seemed to fit kind of perfectly in the SART biennial report because that was a requirement that it be part of the biennial report. And so it seemed like that was where that piece could lie. And that's great too, because if this is something that a county or counties need to discuss, the SART is a perfect place to do that.
All right, our next question. Hold on. There we go. Okay, so I just ask the questions. I love this. Oh, Deepika. Katie Couric, or who am I trying to be like? Anyway, so that's how it shows how old I am. Oh my God, is she still on television? I don't even know. Katie Couric. So how will this new requirement for the biennial report affect SARTs?
Yeah,
I know we talked about it a little bit, but
yeah, so we kind of touched on that, but I'll go a little bit more into it. So the SART still have their same requirement. They will submit the report to Commissioner's Court on December 1st, right? So if you are part of a single county SART, you will go to your individual county. If you are part of a regional SART, you only need to do one report for your regional SART, but that regional SART report will need to go to every single county that is represented. So that is still the same. That deadline is still December 1st of every odd year. So that's the SART's responsibility. The responsibility of the Commissioner's Court, and that kind of goes into our next question, I think, is like talking about that responsibility. But the responsibility of Commissioner's Court will be to submit the report by February 1st of every even numbered year to the Sexual Assault Survivors Task Force. So let's use this coming up time as an example just to like understand the dates, because I know dates can be a lot for folks. So myself included, I'm like, let me remember. So this year, right, is a reporting year. It's an odd numbered year. So December 1st, 2025, our second round of reporting will be due to Commissioner's Court. And then in February, so 2 months later, February 1st of 2026, all of the Commissioner's Courts that receive their report will be responsible for sending it to the Sexual Assault Survivors Task Force. And yeah, Rose, do you have any thoughts or anything?
No. Yeah, and that's going to be in Deepika also will have detailed information, because some of the other questions that we're getting is like, okay, we've heard of this ominous task force, the task force. Oh my God. But there is specific, like an email that you send it to, and we have all of that information packaged together in a document for you. But I think the biggest thing that we wanted to make sure that everyone was aware of is the responsibility, because there is a what do you call that, consequence. There's a consequence to this that's attached to this. And again, this isn't about trying to get people or play gotcha. It really is about our wanting to be as survivor centered as we can, as transparent as we can as a state. How can we do this together? And also recognizing, as Deepika said earlier, that some folks are in different levels. Like she just had a couple that just said, hey, we're trying to start a SART. And that is beautiful and lovely. And we are here to help you. And there are some that didn't need a law. Like I think of Houston, they've had a SART forever. I think South Texas had a SART forever. San Antonio, maybe. There's some of the bigger cities already in Dallas had a SART already, didn't need a law to tell them about this. But unfortunately now we have the law that we're trying to let's get this more consistent information and things like that. So
yeah, and I think the other like big question that I've been getting, and I believe Rose has been getting this too, is Rose spoke about like a consequence, right? And so one of the things that's in the bill is that Commissioner's Court must turn this report in to the Sexual Assault Survivors Task Force in the governor's office by February 1st of the even year. So coming up February 1st of 2026. And if that report is not received, that could affect funding. And that's funding to the county as a whole. And so that's something we wanted to make clear. So that way folks aren't, worried about individual entities. It's about funding as a whole, and it could affect other funding. But I think that we just wanted to kind of make that clear. We have like a cheat sheet that sort of goes into that. And if you are getting your report into Commissioner's Court and Commissioner's Court is submitting that to the task force,
Mhm.
then you will be in good shape. I think we just want to make sure that people understand that. I know that's been a big concern, but also, we're here to support. We have these like great documents that we made that will give you some more information on what exactly this means if you have any more questions. About that. And going into that last question about how SARTs will be supported as these deadlines approach, one of those is that we have these documents that kind of go into what this means, what is this law, how this is going to affect us. Again, the SART's responsibilities are still the same, just getting that report into Commissioner's Court on December 1st. We will also be doing a lot more office hours now that we are 3 months away from the reporting deadline. So we'll be doing a lot more office hours. We have our biennial framework one pager. I love a one pager that kind of gets to the nitty gritty of what you need in the report. But we also have a larger framework guide that we had sent out last year that we are just amending that will get sent out later in the month, but the main information that's in that document is still the same, but we're just going to be adding a few more things about case review, amending the data points, making sure we include the updates from HB 47 and SB 608. And so we will have those documents coming out. I'm happy to do a one-on-one whenever you want. We'll be sending out a follow-up email and you can always contact me directly, and there's the email that you can reach out to me for if you have any questions. We are going to be doing our coordinator chats on a monthly basis. Again, office hours will be start ramping up, and so yeah, we're here to support you if you have any questions. We have a lot of great material on our website. Rose and I will be doing a few more of these TAASA Talk SARTs in the incoming months, just to kind of keep y'all in the know about any SART related news and just biannual report support.
And we know that y'all are busy, right? I know at the local level, not only do you have now the adult sexual assault response team, that meeting you have to go to, then some of you also have to go to the MDT for the children type of meeting. Then you may have the CSA's human trafficking, whatever. There's all these different things that you all are doing. And we completely, I know that it gets overwhelming. And so what we're trying to do is just to provide some source of information and be a resource to you all so that you don't have to remember all these things. We're here. As Deepika said, she's going to have office hours. She's going to have all these ways to get in touch with her. We have a ton of templates on our website, taasa.org/SART. I believe it. There we go. Thank you, Courtney. So we have a ton of resources there. And, again, the last thing we want y'all to do is to stress over this. I know it's like, oh, we got consequences. That probably wasn't the best word. I should have come up with a softer word. I can't think of it. But there's like these, whatever, I can't think of it. Anyway, consequences. I don't want anybody to get stuck on that.
Accountability, maybe.
Accountability. Thank you. A little bit of an accountability. So just put together what you can and submit that. Get your deadlines together. So if you had my advice, my unsolicited advice, get the information together as much as you can. Get it in December 1 to your county commissioner, and then get with your county commissioner. Give them the documents that TAASA is going to send you after this, so that they know their responsibility. And they need to get it. It's just an email. They'll send it over to the governor's office task force. And I think the other thing really quick is to keep in mind as we're doing this, because I know people are going to be rushing to get this done. Let's not forget about the importance of survivor privacy. I think I see a lot where folks are like, let's get it done. And let's just start passing things out with everybody's information, everybody's addresses and all that. We have to be careful, and we have to follow the law, the state law, in regards to survivor privacy. And also who we have at the table, things like that, right? You all know that better than I do. I don't work locally directly, but I know that you all do. I just wanted to do a quick reminder on
Yes,
survivor privacy as we do this. So,
yes.
yeah, I don't know if you
Privacy and
have anything to
consent. No, yeah, that's a great reminder. Privacy and consent are so important. Thinking
add.
about that as we're going into case review. I know some folks have already started, but I know that's going to be the big piece for the next 2, 3 months is people really going through their protocols and doing their case review and just making sure that you have your consent forms, and everything from your survivor, because doing these protocol reviews and doing this case review can really show how things are working in your community. So they're so important. And also, our number one priority is the survivor and making sure we're protecting them. So, just thinking about that. And if you have any questions around that, you can reach out to me. I'm also very happy to read reports prior to the deadline. If you want to talk about your last report and talk about what worked, what didn't, I've done that with a few starts as well. So again, always happy to support. And I just, I say this a lot when I meet with people, but if you have anything that you think, man, it would be really great if you could give us some more documentation on this, or it would be really great if you could do a training or do a talk, Rose and I are going to be doing more of these. And so if there's like a topic that you're interested in, let us know. We want to hear from you. Like this is for y'all. So we want to make sure that we're meeting your needs and getting your feedback.
And y'all, we are working very closely with the governor's office and the Sexual Assault Survivor Task Force. TAASA, we're a member of the steering committee of that task force. And Deepika works very closely with the governor's office on all things SART. So I just wanted to let you know that we are in communication. It's a great thing. It'll be helpful, I think, as we're trying to get all this through the finish line. But we're here to support you. And I think at the end of the day, that's the message here is that we are here to support you because you are supporting survivors of sexual assault in your communities.
Yes. Yes. And thank you so much for that comment. And again, we know that this is a busy time, that the big priority is the biannual report. But one thing we really want to think about, and something that I think is going to be a focus area next year, is really thinking about what SARTs can do together. I mean, you have all of these experts in the room who are passionate about serving survivors to the best of their ability. And the way we can do that is being together, right? And so thinking about what the SARTs can actually do. I mean, it's great that we have this legislative mandate to get this going. And I know there's requirements and those are important, of course. And also, let's think about, since we have all these great minds in one room, what we can really do with that and how we can better serve survivors. So I look forward to, speaking more on that next year and doing some more work around that. Yeah. And anything else, Rose? I know we could probably talk about
We
SART
could.
forever.
Let's cut ourselves off.
Yeah, I know. We were talking this morning and I was like, yeah, this will just be like 10, 15 minutes and we're almost at 30 minutes. So, so we will let all of you get back to your day. If you have any questions again, please feel free to reach out to us. We look forward to hearing from you and yeah, have a wonderful Wednesday.